times a day for my Methotrexate shot. And it's basically a subcutaneous shot that I do myself every week for Behçet's disease and arthritis. It's easier than taking the pills for me personally because I have stomach bleeding and I have all kinds of problems when I take the pills. So I actually prefer the shot, and I actually feel that it is more effective than the pills, but I guess it depends how severe your problems are and what you can tolerate. So I don't think it's that bad, and I'm going to show you how to do it quickly, and I think it doesn't hurt at all. Also very hygienically, because I've had cellulitis more than this many times in my life, but never once because of shots or infusions that I've given myself. So I think, especially if you're on anything that's immunosuppressive like methotrexate, you should be super, super, super careful how clean everything is. So, let's get started. Alright, so we're going to take this mess and turn it into this. Alright, so we have switched from cabinet view to lamp view, which is ridiculous, I apologize. We are going to clean the table, and by clean, I mean clean, disinfect. Disinfecting wipes you could use alcohol, whatever you have that disinfects the surface you're going to get everything ready on, because it needs to be disinfected. So, I want to have everything I want and need here so I don't have to go running for anything. So, I've got sterile drape, sterile gloves, alcohol, tape if I need it, band-aids, methotrexate, sterile gauze pads, needles, alcohol prep pads, and my sharps bin. So, I will set everything up and then we shall commence. I have everything set out here. I always put out 2 needles just in case one of them is a dud, which has happened to me more times than I can recall. So that's it. Hi, so I am going to take off my glove, put this up here, and I'm gonna wash my hands. Soap and a sink. You use hot water, and that's how you wash your hands. I just wanted to say that I've seen a lot of videos out there where people do not wash their hands, they don't wear gloves, they don't put a drape down, they don't wipe everything off with alcohol, and I've had my arm swollen up as big as my leg from cellulitis. And I've had a lot of painful experiences in my life, and cellulitis is honestly one of the more painful experiences I've been through, and I don't really suggest you go through that. Alright, so the first thing we have to do is put on gloves, and I'm just going to show you how to do this properly in case you don't know. Actually, I was never taught medically. I learned this when I had to go through lifeguard training when I was in high school. So, anyway, you take it out, open it up, this left and right. Now, you only want to touch the inside of the glove with your skin. And they're folded so that the inside cuff is right here. This part where it's folded is actually the inside, so that's what you want to touch. Get your hand in, go to the right, do the same thing, but you don't want to touch with your skin what you've already put on, so be careful. Alright, and then you can pull it down like that. This kind of, I just wanted to say, applies not just for methotrexate shots, but any kind of subcutaneous shots. The places you can do them are in your upper arms, like in the back of your arms. So it's kind of hard to do yourself, so I don't recommend that. Your stomach. But my problem is I also have to do immunoglobulin subcutaneous infusions once a week, which I have to do 2 needles in my stomach, and I really, even despite the prednisone puffiness, I don't have a lot of subcutaneous fat either on my arms or my stomach. So, and now I just touched my sleeve with my gloves, so I gotta change them. By the third place, which I do my shot, is my legs. Alright, so after all this, the first thing you want to do is wipe down a spot that's halfway between your thigh and your knee, like about here. And you want it to be on the outside of your thigh. You want to make sure always to wipe in the same direction. You don't want to like go back and forth like that because it spreads germs. You want to go back like that. And I do this twice because you can't be like too careful. And the other thing I want to say is you want to make sure the alcohol dries. Okay, so what you want to do is take your alcohol pad and wipe the top of your vial. This is the lovely bright yellow Methotrexate vial. Always wipe in the same direction. I do it twice. It needs to dry to kill the germs. So that's fault too after washing your hands of many videos I've seen. So let that dry. So you want to take the needle, right? This is what, 25 gauge. Now what I do is I make sure this is tight, tight, tight. Alright, so the maximum dosage usually that you can administer via subcutaneous injection is 1 milliliter. So that's why they give you these tiny little insulin needles. Otherwise, it could cause a lot of pain and just not absorb properly. So after you've uncapped it, you want to draw air, whatever the dose of your medication is. So I have to take 0.75 milliliters of methotrexate. So I draw out 0.75 of air, right? And now you want to, while this is upright, insert the needle into the rubber top, push, and then push down the air. And why you want to put the air in first is so that you don't create a vacuum in this glass and the liquid's easier to draw out. And you do this with the needle pointing down, and then you flip it over and draw out the same amount of medication. And I halfway through kind of push out the air at the top and then draw back out. And usually I don't really get air bubbles if I do it that way, but if I do, you just give it a good knock and push it up. And that's it. You can draw it back to your dose and then take it out. You're ready to go. Alright, now I'm going to talk about if you've got these single-use vials, you lucky ducky, then all you have to do is pop off the cap, which you have to do initially with the multi-use vials anyway. And I don't care what anybody says, I still clean the top of this with alcohol. Same thing, same direction, same process. Let it dry, get the needle at the same time as that's drying. Screw it on tight. Pop the cap off. Draw up your dose in air. And then you do the same thing. But you want to make sure the tip of the needle does not touch the liquid. It's the best practice. So put it in. Make sure it doesn't touch. Push the air down above the liquid. Then you can push it all the way down. Flip it over and draw up your dose. And do the same thing, like in the middle, just push out that top air. Put a good knock, get out the rest of those air bubbles, and then pop, and you're ready to go. What I do actually to make this as painless as possible is I feel with my index finger, right in the area where I'm going to do the shot. I grab it like this, and you don't want to go into your muscle, right? It's just subcutaneous. So you can do this at either a 90-degree angle or a 45-degree angle. I prefer to do a 45-degree angle. So I'm gonna feel any, like, where the least sore spot, like if I poke it, if it doesn't hurt, that means there aren't like a lot of nerve endings there, and it's a good spot for a shot. I think this is a good spot. Get my alcohol again, because like I said, can't be too careful. Wipe it. I always have the gauze pad ready. I wipe my fingers too. Grab it, right? Let it dry for a second. And then I do, like I said, like a 45-degree angle. And don't even feel it. Nothing. Let it go. And I kind of time this over like, I don't know, maybe like a minute. I do it slow because this is like a potent drug. You take it out like this, boop, right where the shot was. I'm just putting on a Band-Aid. And honestly, I don't even see where it bleeds. And sometimes, just to be careful, you can wipe it down with alcohol again before you put the bandage on. I know some friends who have had a lot of cellulitis problems like I have, and that's what they do. And it's kept it at bay, so, you know, same thing, whatever works. So when you're done, you want to take your Methotrexate syringe. There's always, like, I don't know if you can see, a little liquid left. And put that in your sharps bin. And likely you'll be ending up with some waste that looks like this, a bright yellow. This light is driving me nuts. And I put that in here too, just because this is my cytotoxic bin that I use separately from Methotrexate. And then I take my gloves off so I don't touch the outside of the Methotrexate, right? And then peel them off. And I actually stick those in there. If you have like these little vials, the single-use vials, you want to put that in too. And then you can close this. Anyway, that's a basic how to do a Methotrexate / subcutaneous injection. Subscribe, comment, let me know let me know how you do this, how you handle, you know, any drugs, shots, injections, infusions, whatever you have to do, if you have to do them, and what you think of this technique, my super clean and push. I have to do an infusion with a pump and all that fun stuff, so I can show that to you too, because that's definitely more complicated than this. This is a breeze. So I hope you enjoyed my medical information. If you have any questions, comment. If you have any comments, comment. That's the end.